Thank you, Julie. I'm here this evening to represent the Board of Directors of Monroe Clinic. And the board is made up of a number of people, many if not most of whom are drawn from the communities that the Monroe Clinic serves, both here in Wisconsin and in northern Illinois. I was born at St. Clair Hospital in that 1939 edition, or the original hospital that we saw the picture of. And I've lived in Monroe essentially all my life, except for about 10 years when I was away at school and in the service. So I'm well aware that we in Monroe have been blessed over these past 75 years with the availability of high-quality health care right here in our own community. The board of the Monroe Clinic has as its goal to ensure that this tradition of health care excellence and accessibility continues for many decades to come. As has been discussed by many of the speakers this evening, medical care delivery changes on almost a daily, certainly on an annual basis, but on almost a daily basis. The technologies involved, the way care is provided simply is different now than it was when the buildings that we're operating in were designed and constructed. The original building is 70 years old. Other wings are 50 to 60 years old. Even our newest building, the 1970 hospital structure, is almost 40 years old. We came to learn in this planning process that most healthcare planners assume or project that a hospital facility is good, a building is good for about 50 years, and that's only if continually renovated and updated to keep up with necessary changes. So about 3 or 4 years ago, when the board and the administration and the staff started looking at what our facility needs were, we identified a number of areas that were current needs, services that we were providing that simply our buildings were not allowing us to do the way we wanted to. The birthing center has been mentioned, cardiac care, outpatient procedures, those are just a few. It was also apparent that those inpatient rooms in the 1970 wing were in need of a major update and renovation. The first plan then was to do that renovation and to add a stack or a tower, a building in between the existing clinic and the hospital to house some of these programs that I've identified. The more we looked at that, though, and the more we had consulted the professionals as to what this would cost and what it would mean in terms of operation and future expansion, it became very clear that that was a costly way to go, and it was short-sighted, because it would do nothing to improve the efficiency of how we deliver health care at the Monroe facility, but it also would create obstacles for future expansion and development down the line. So, after about 2 years of study, the Board of Directors voted unanimously to proceed with the plan for the Northwest Addition that's been described here this evening. It's a plan that the board truly believes will meet the needs, the healthcare needs of the Monroe and surrounding communities as soon as it's built and for many decades to come. Again, it's our goal that the 75-year tradition of having exceptional health care close to home will continue.
My name is Tony Rogerson, and I want to offer one physician's perspective on the project. I'm not only speaking as a physician, but also as a board member and a community member for 15 years with 3 kids in the Monroe public schools. So I'm planning to work here for a long time and very motivated to see the clinic thrive during the next 15 to 20 years. First thing I want to say is, after working here for 15 years, that I really believe in the model that we have here. The model of an integrated multi-specialty group and hospital has allowed me to practice in a way that I may not have been able to do if I just hung my own shingle. The mission is stated by Sister Mary Noel too. I really inspires us, and I'm really thankful that I've been able to see all comers for the past 15 years without regard to their payer status. So the model allows me really to focus on the practice rather than the business of medicine. So going forward for the next 20 years, what are the keys to our success? And I would say that they're probably the same as they were back in 1939. We need to maintain and build the trust of our patients. Our patients have to believe that we're going to provide quality, we'll be there when we need them, and we deliver it in the way they expect. So how do we do that? Again, it's probably the same. We recruit the best people, and we provide the optimal environment to practice the way they were trained. Okay, so will this project help us achieve that? I think it will. It's been said over and over that medicine is changing rapidly, and I would guess that if anyone in this audience had their tonsils out, you were probably in the hospital for 2 or 3 days. And if your kids had them out, they were probably out of the hospital within 3 to 4 hours. So, though we've had a lot of success, as our rankings show for hospitals our size, we really can't continually refit our facilities as we go forward, given that they were built for the way medicine was practiced 40 to 60 years ago. And another very important factor that I can't overstate is recruitment. We have to be able to recruit and retain talent. From nurses to administrators to physicians and everyone in between, recruiting to a town of 11,000 is not that easy. And if we allow our facilities to even give the perception that they're second rate, that's going to be more difficult. So, last point I want to make is we recognize that our patients have choices. Madison's not that far away. Going forward, I hope that people in our service area will take pride in the clinic and realize they can have a tremendous healthcare experience here. Thanks.
All right, that kind of wraps up the formal part of our presentation. I want to thank all my colleagues here who have helped with this. I hope you can sense the excitement that we have for this and the commitment we have to continue the fine tradition and commitment of service of Monroe Clinic and St. Clair Hospital into the next 70 years.